Tonight we continue our look at the big changes that are upcoming in the Marquette medical community as a new hospital and a huge medical center will be built over the next few years. Our focus tonight is cancer care and other new efforts that will be offered in Marquette, including new medical department heads, more doctors, research, and others. Tomorrow night it'll be the Heart Program in honor of American Heart Month, which is held every February. ABC 10 and CW5 News Director Greg Peterson has the second of 4 reports.
It may take 4 years or more to complete. The schedule depends on how soon tons of polluted soil and a building are removed from nearly 40 acres where the new hospital will be built, roughly between Snowberry Heights and the 41 bypass. Upper Peninsula Health Systems Marquette is already expanding medical services.
What we're really excited is that we're actually bringing in more physicians. We've brought in intensive care doctors.
The Marquette Cancer Center is now part of the Duke Cancer Institute.
We have a new oncology medical director. He'll be starting at the end of March, and he's really going to advance our oncology program.
Cancer research and tender care are among the top goals, using all that's available, like latest technology and experts.
Oncology is probably our one that we're very proud of. We're affiliated with Duke Oncology Network, which is Duke University Medical Center, and they've been working with our existing cardiologists and staff, and the new medical director is going to help us take research a little further. It's going to help us with some protocols and development and new services that we'll be able to provide.
Part 3 of our series will explain how the Heart Center at UP Health Systems Marquette is saving lives in real time, including the cardiac cath lab and helicopter. The quicker a heart attack victim is treated, the better chance of recovery.
We're working on a couple of cardiovascular surgeons.
The cardiac team will have more doctors.
We have 3 new cardiologists who have signed contracts who will be coming, one as early as February next year, and then a couple others afterwards throughout 2015, and then one in early 2016.
Improved customer care and working with outlying hospitals are among the goals.
Then really spreading throughout the Upper Peninsula. So we obviously have a clinic system. That's the access part. We need to make sure we have good access points across the Upper Peninsula, so patients can enter the care. If they have to drive a long way to care, especially where there's so much rural area in our Upper Peninsula, they need to have access to care there.
And we got the great residency program here. And being part of a teaching hospital, you have a lot of family practice residents who decide to stay in the community, and that's how we can keep family practice here in the UP in our towns, by having residents who do their service here and work at Marquette, and then when they graduate from the residency, they go in and hopefully stay in the UP to provide care. So we've got a lot of great services that we're keeping, and we have a lot more that we want to recruit too.
Not all docs stay in the UP.
They spend some time in Marquette, or they work a few years and they move on.
For ABC 10 CW5, I'm News Director Greg Peterson.